Chickenpox vaccine now available free to all young children on the NHS starting January next year. This could change everything for families across the UK. But here's where it gets controversial. While this move promises protection and relief, vaccination rates for other childhood illnesses are dropping, sparking fresh debates. From January, the NHS in the UK will offer a free chickenpox vaccine to all toddlers, administered in 2 doses at 12 and 18 months old. This jab will be combined with the existing MMR vaccine, which safeguards against measles, mumps and rubella. There's also a plan to catch up older children who missed out initially, making sure no one is left behind. Up to now, parents who wanted to shield their children from chickenpox, a virus known for causing red, itchy blisters, often had to pay privately, sometimes up to £200, putting vaccination out of reach for many. Why the big change? Ministers hope that by providing the vaccine for free, they can protect children from the rare but serious complications chickenpox can cause. Beyond health, they also want to reduce the burden on parents who might otherwise need to take time off work to care for sick kids. According to the Department of Health and Social Care, chickenpox leads to an estimated annual loss of £24 million due to parents missing work and overall reduced productivity in the UK. Health Minister Stephen Kinnock emphasised, "We're empowering parents to keep their children safe. This vaccine prioritises children's health and supports working families." But here's the part that many miss. This announcement arrives amid concerning new data, revealing that none of the main childhood vaccines in England hit the government's 95% uptake target for the 2024-25 period. Only 91.9% of 5-year-olds had received 1 dose of the MMR vaccine, a figure unchanged from last year, and the lowest since 2010-11, according to the UK Health Security Agency. This raises critical questions about vaccine confidence and what steps need to be taken next. So why is chickenpox vaccination such a big deal? While most children experience chickenpox as a mild illness, for some it can be dangerous. Pregnant women face risks affecting both themselves and their unborn babies, and very young infants and adults can suffer severe complications. In rare but serious cases, chickenpox can lead to inflammation of the brain, encephalitis, lungs, pneumonitis, or even strokes, conditions that require hospital care and can sometimes be fatal. In November 2023, the Joint Committee on Vaccination and Immunisation, JCVI, the advisory group guiding UK health policies, recommended introducing the chickenpox vaccine within the NHS schedule. Experts are clear that vaccinating children will sharply reduce chickenpox cases overall and, importantly, bring down the number of severe cases. Dr. Gayatri Amirthalingam of the UK Health Security Agency called the vaccine a lifesaver for some children. Professor Adam Finn, a paediatrician and former JCVI member, described chickenpox as a rotten illness, often dismissed as trivial, yet one that can have serious consequences. He said the vaccine will make chickenpox a thing of the past in the near future. Interestingly, the UK has been slower than some other countries, such as the United States, where the vaccine has been routine since the 1990s. One reason for caution was the belief that chickenpox remains dormant in the body and later reactivates as shingles. Health officials worried that if chickenpox stopped spreading in the community, people wouldn't get natural immune boosts, possibly leading to more shingles cases later. Now, we understand these concerns are far less significant than once thought. Almost negligible, Prof. Finn explained. Real-life stories highlight the vaccine's importance. Sarah, mother to 2 young girls, shared how last year both her daughters needed hospital care after severe chickenpox. Her youngest, Mia, was covered in spots and developed a skin infection, becoming seriously ill. She was just completely out of it, floppy. It was terrifying, Sarah recalled. Looking back, she urges other parents to consider vaccination, saying, I wouldn't want any child or parent to go through what we faced. In addition to the chickenpox vaccine for children, the NHS offers a shingles vaccine for older adults, everyone turning 65, those 70 to 79, and those over 50 with weakened immune systems. It's important to know that shingles itself can't be caught from someone with chickenpox, but someone who hasn't had chickenpox before can catch chickenpox from a person who has shingles. Although rare, it's also possible to get chickenpox more than once. Addressing the recent vaccination coverage data, Minister Kinnock expressed concern about vaccine hesitancy, which he believes rose following the COVID pandemic. To combat this, the government is launching national and local campaigns to educate families about the clear benefits and safety of vaccines. This is 100% safe, he stressed. But here's a striking statement that could ignite debate. Kinnock also vowed to fight against misinformation and conspiracy theories on social media, calling it the responsibility of the government and sensible voices to win this battle over false narratives that threaten public health. So what do you think? Will making the chickenpox vaccine widely available free of charge change the vaccine landscape in the UK? How can we better address vaccine hesitancy and misinformation that may be holding families back? Join the conversation and share your thoughts below. Do you agree that the government should be more forceful in tackling anti-vaccine myths, or do you think there are deeper issues at play? Your opinions matter in this important discussion about the health of future generations.